All right, welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Joanne Newborn, an executive coach, dental consultant, and founder of Newborn Dental Evolution. Joanne brings over 2 decades of corporate leadership into the dental world, helping dentists think more like CEOs, lead their teams with intention, and scale practices without burnout. Today, we're diving into how practices can align vision, mindset, and strategy, and what happens when you treat your practice like the business it truly is. And thanks for coming on, Joanne.
Yeah, thanks for having me, Nick. It's great to be here.
So, you emphasize starting with a vision. And I'm curious, what kind of patterns do you see when dentists skip that step?
Yeah, it's really interesting because some dentists are really clear on what the vision is. And then there are other dentists that really, they're not happy working as an associate. So they think, oh, well, I'd like to have my own practice, but they don't really have that purpose connected to it. And so that's when I see chaos coming on, right? They don't know where to start. It can be incredibly overwhelming to open a practice and have a practice. I mean, there's so many different elements of the business side that are involved with it. So when they're not connected to a vision of who they are, what they want their practice to be, who their ideal patients are, what are their strengths that they're bringing to the table. Because even if someone is a family practice, there are still strengths that they're bringing to the table that are going to be differentiators from other dentists in nearby and things like that. So basically, I think you said, what do I see? I see chaos when they don't have a defined vision for themselves.
Well, and that's the opposite of what you want. I've talked to some dentists that say, in dental school, they're not learning how to run a business. They're learning how to have a clinical mindset in their practice. So how do you suggest, or what do you tell a dentist to shift into a more CEO role?
There's many different things, but the first thing I really want to start with is defining their leadership style, because it's probably something that they've never thought about before in their lives. And even when we work in the corporate space, a lot of people haven't even thought about this before. And defining your leadership style is really the foundation of who you are. That's going to affect who you're hiring, how you're training them, how your team is functioning and interacting with each other. And there are so many other nuances, right? It starts to give you the confidence to be able to want to understand the financials behind it and think about where you want to grow your practice and just be thinking bigger picture all the time. And, I always say that, when I start to work with practice owners, that I really hope you're not the one throwing out the garbage at night. Not that there's anything wrong with that, but that's part of being a leader, is being able to delegate and being able to set your expectations and having the team members all be able to work together. And that is something that should not be on their plate, but a lot of them do actually throw out the garbage at the end of the day.
Yeah, well, and that's admirable, but it might not be how they want to be spending their time, maybe. Like success, I think, also comes in terms of revenue and profitability. And you were mentioning earlier that you had one practice that grew by 40% in 1 year.
Yeah.
Well, that's a huge success story. What made that growth possible?
So we work with all the different areas behind the scenes of a practice in terms of the business of a practice. And so we dive into all of those different benchmarks. So that would be their overheads, it would be marketing, it would be taking a look at new patients versus attrition. Like a lot of times, people will take a look at new patients and you might see, oh, wow, I got 40 new patients this month, but they're not looking at the attrition when people start to cycle out at 18 months. And so sometimes, maybe the real number is only like 7 new patients in a month. So it's really diving into all of those numbers on a monthly basis. And it's fine if we're the ones doing it. Like, I don't really always expect dentists to have their hand in every single thing. There could be people in their practice that really excel at some of those. So I'll work with those team members to help them get up to speed, or we can do all of that behind the scenes. But on a monthly basis, we have to be looking at all these different numbers. Are the pre-appointments in place, or are patients walking out the door without their next appointment? Is hygiene getting every 6 month, or a lot of times now people are going for hygiene 3 times a year that's covered by insurance. So making sure you're getting all of that before the patient walks out the door, and any gap that we see on our side, each month we'll flag it. We'll be like, these are the areas that you did really well in, but I see a gap right here, and that might affect your revenue for next month. And so it becomes really easy when you just start to get into the practice of looking at those numbers and all those different areas every month, just to see, where are we excelling, where did we take a dip, let's get back on top of it. And again, it's getting all the team members involved as a whole to help the practice grow.
Yeah, and what do you see as far as, strong leadership? Like, what does it take to be a strong leader in those practices, and the way you address or approach them, and how you kind of convey that to their team?
Yeah, that's a great question. It really does start again with that vision, and making sure that every single person in the practice knows that vision, lives it, breathes it. You should be thinking about it, saying it in the morning huddle, and then really, really being able to set your expectations with your team. Now, that sounds really easy. It's a difficult thing to do. So there are many times where I will get on coaching calls with my dental clients, and this person on my team, and they did this and this, and everyone's going to have their own agendas, and they're going to push for what they like to do best. And it's really about resetting, go back, reset your expectations. Maybe you want to put them on a note in the break room, like whatever it takes, so that people know your expectations. And it's not unkind. You're actually doing the team a favor when you're setting your expectations with them, because now they know exactly what they should be doing. But you know your expectations better than anybody else. Sometimes you're going to have to over communicate them to the team, but really, though, that's the key in terms of having a really strong high performance team, is being able to set those expectations around the vision that you have for the practice.
Sure. And what about monthly metrics? So if you're working with the team and leadership, and what sort of monthly metrics are you measuring to help guide success?
Yeah, that's also a good question. So we have a huge dashboard that we put together for all of our clients. The first thing that we want to look at every month is the production, right? And what percentage of the production is coming from treatment, and what percentage of the production is coming from hygiene. And then we take a look at collections and the A&R days. So we want to make sure that, there's not too much sitting out there, because you could have fantastic production, but if your collections isn't matching it along the way, that becomes difficult. And then, from there, we can take a look at insurances. Are the ones that you want to let go of? Are there others that you want to bring on, or you want to have no insurance? Those are all, that goes into the vision, right? And so I speak at universities with dental students, and I want them to start thinking about it then, like when people talk about like how hard they want to work, right? Well, you're going to have to work harder if you're taking a lot of insurance versus not having insurance, but neither one is good or bad, right? It's just thinking about it. We also take a look at the percent of hygiene pre-appointments. We look at how many appointments they already have in the books down the line. We look at new patients, and we look at the attrition of patients. We look at outstanding treatment. So you can take a look at how much treatment's been presented. Sometimes I see almost like $500,000 in treatment that's been presented that's just left hanging in the wind, right? So someone in the practice, it doesn't have to be the owner or the dentist. It can be the front desk person, it could be the office manager, it could be the treatment manager, depending on how big the practice is. Starts getting on the phone and start talking to people, and start letting them know that this was presented, and this might be a bigger problem if it isn't taken care of. So it's really, when we're diving into those numbers, we see every low hanging fruit opportunity there, And, we can dial into by patient. So if we see that someone's coming in that day, I might see, oh, they also have their husband that comes here and their two children, but they're not scheduled for anything. Let's make sure that we get them scheduled before this person leaves. So it's really just filling in all those gaps. And, you really do need someone behind the scenes looking at all of that, because I'm sure that running a practice every day in itself is busy and overwhelming, unless you want to take a look at cancellations. Do you have a cancellation policy? I've had practices that call me and they're like, we're just having a lot of cancellations and the team's standing around and we're paying them. That's another thing too. What are they doing when there are cancellations? Like, everybody should have their primary and secondary role. So I know I'm a hygienist. I have a cancellation. I have a list of patients that don't have their hygiene appointment. I'm going to get on the phone. I'm going to start scheduling them. It should be like a dance, really easy dance.
So other than cancellations, maybe what other warning signs are blatant that you've seen and worked with that are, indicating there might be a drop in revenue or a drop in morale in the practice?
The big ones are the appointments, right? That's a big one, because if you don't have those out far enough, then you're going to have gaps in the schedule. The other things that I take a look at, I said the new patients and the attrition, that's a big one. And also looking at your A&R, right? So you want to make sure that you're collecting at the pretty much percentage same rate as you're producing. Obviously there's going to be a gap in time, and then we can look further into this, like, oh, why is this so much over 90 days? Oh, well, they're doing Invisalign and that's going to be charged over time. So it's really knowing your practice, if you're the dentist, and what's going on in the practice, so that you can answer the questions that we have. So then we're not concerned about that. Okay, great. It's going to be over time. Then we are going to see that, over 90 days is going to be a little bit bigger, and that's okay. We're not actually losing the money. It's just because we have these things going on. The other piece is we take a look at what else can the dentist add into either their treatment or hygiene to increase the revenue that's coming in. So we have certain benchmarks in terms of that. And at first you think, well, we take insurance, so we can't really bump anything up. There's lots of ways to be able to bump things up, and it's of a value to the patient, right? I'm not sitting here. I'm a patient too, right? And I certainly don't want to feel like I'm being taken advantage of. But, there are, cancer screenings. There are some people, there's two ways that people come into an office. We're either going to move away from pain, or we're going to move towards pleasure. So if I'm moving towards pleasure, I want to know more about teeth whitening and Invisalign and all those things that may not be covered by insurance. And if I'm moving away from pain, which I'm that kind of person, I want to know every single thing to prevent me from getting any kind of cavities or having any kind of issues at all. So I'm willing to pay more money for anything that's going to help in terms of prevention, right? So I have a prescription for a special toothpaste that's going to, keep my teeth more protected. So you really want to know your patients really well too. And that's something that we teach in the morning huddle, to go through the day. Who's coming in? What's their behavioral style like? Do they move towards pleasure or away from pain? So you know what to talk to them about in terms of what's valuable to them.
Sure. So really a comprehensive approach to, cross-selling, upselling, but also making sure that there's comprehensive, oral health approaches. It's a whole system. So how about getting the patients in there from a marketing perspective? What do you see as the most uncertainty, or what are the dentists or whoever's in charge, their CEOs, where are the roadblocks for them as far as patient acquisition goes?
I would say the majority of dentists are really confused about the whole marketing piece. It's a website, but then when they sit down and start talking to, and we like to be in those meetings so that we can sort of translate, and we do that with CPAs as well. We'll be there so that we can translate. So they sit down with the marketing team and it's like, okay, it's a website. It's getting new photos, it's SEO, it's paid Google, ads. There's so many different things, but it just is kind of like all the same usually to a practice owner. So really knowing and learning, and like we will ask the right questions. What is going to be the most beneficial for this practice, where it's located, with the vision that you have? I can't say, everybody, you should do this. It's going to be very different depending on all these different factors that I just mentioned, right? And as the practice grows, the benchmark percentage that they should be spending on marketing stays the same, but the amount of money that you're going to be spending on marketing is going to increase as your revenue increases, right? So really understanding that, so now we have more money to invest. What are your primary marketing goals that are really going to help? What are your secondary marketing goals? And then what's your internal marketing? There's a whole system of internal marketing that doesn't really cost anything or very little. So really educating them on that. And I don't like to overwhelm dentists. It's very easy to get overwhelmed, any business owner. So really looking at what is the primary thing we need to focus on first? What's next? And then building on that little by little, so then they can see this incremental growth along the way.
Yeah, and overwhelm's real. I mean, burnout's real, and I imagine especially for early career dentists. What do how do you help clients, build a model or system that doesn't rely on overwork?
Yeah, and that nothing makes me sadder than seeing someone that spent all this time and energy and effort and passion to open a practice and then have to walk away from it because they couldn't get on top of everything, and that everything became overwhelming. It might not even be from like a money perspective, but a time perspective. Again, it's really, really relying on your team and kind of going back to setting those expectations and having the team do as much as possible outside of the clinical work, especially the admin team, that they can do, so that really, that hopefully that the dentist role is to be a clinician and to be the CEO of the practice. And then nearly everything else can be handled by someone else. So all that marketing I just talked about, if there's a team member in the practice that has a good understanding of that, and maybe that's their strength and they love it and they're passionate about it, hand it off to them. Let them handle the marketing, in conjunction with us. You have a trusted resource that's not going to steer you in the wrong direction. So you have to surround yourself with the right people to help you. And that's the way to avoid burnout. I would say the majority of dentists believe that they're just going to do it all themselves. And then when that happens, that's when the burnout happens. You can't know about it. It's like me taking my car and saying, like, I'm never going to take it into the dealership or mechanic. I'm just going to figure out how to fix it. Right. I would not drive out of my driveway if I did
Yeah,
that. Right. I don't
right.
know anything. I have to surround myself with the right people that are going to be able to help me with that.
Yeah, experts, right? Well, what about like mindset shifts, or I guess when you're talking to the leadership team, or even people supporting leadership, like what are mindset shifts there that you coach on in order to help see success?
It's that big one of shifting into a CEO mindset, because like you said, when they're in school, they're not learning about any of this. That's why when I go to universities, I like to talk about leadership and creating this CEO mindset of, and I say this over and over again, I must sound like a broken record. I say it to my clients. It's your practice. You get to make all the decisions, right? That you can be open and listen to everything that your team wants to share. At the end of the day, it's your final decision, because they get weighted down with, oh my God, this person said this, and this person who's the office manager, she said that she knows this isn't going to work. And and the other thing too is, I'm a big fan of beta testing things, dipping your toe in the water. So if you want to try something new, test it out first. You don't have to go full force. That meaning anything. You could bring on a new associate. You want to bring on an additional hygienist a few days a week. You want to try offering something new. You want to try a new system in terms of insurance, whatever that might be. Just test it out first. Nothing is a make it or break it situation. But I think going back to the question you asked, that mindset shift, they have to understand that it's your practice and you get to make all the final decisions.
Yeah. Well, and I mean, and it's a changing landscape too. I mean, with technology and it's happening so rapidly, what's one thing that you'd recommend practices invest in, maybe financially or emotionally? Where would you say they should put their time and energy?
I would say, do you want me to mention any names of anything? No.
Sure. Yeah.
I'm a huge fan of Dental Intel because that gives you really easy insights into everything that's going on inside of a practice, as long as the information's being fed into it. And it's easy to train people. I'll make little videos for my dental practices on how they can pull the reports themselves, or, we'll pull the reports for them too. But that to me is the most important in terms of the business side and keeping a pulse on exactly what's going on inside a dental practice. I think that makes everything easier. It's easy to see any little gap from month to month. And that also helps to say, you can delegate this to this person. You can delegate this to this person. Like I said before, no one probably thinks about hygienists sitting down and making phone calls. You just think, well, that's the admin team, right? But if the hygienists have patients that don't have hygiene appointments, certainly can be delegated to the hygienists.
Yeah. And what about emotionally? Where should they invest emotionally?
I'm trying to think from an investment perspective. I would say I think it's really important that they make time for their own vacations and own like time off. I have, a lot of dentists will come to me and a lot of them work 4 days a week. Some say like, I'd like to do 3 days a week. And I'm like, let's get it right. Like at the maximum that you're going to work. And then from there, we can see how to delegate things. Do you want to bring on an associate? But let's get this humming and working really well so that you do have the ability to take time off. You don't have to be answering the phones. Do you need to hire an answering service? Whatever it is, you need to have something in place. Is it someone on the team that might check the messages? But you have to disconnect. You have to disconnect for your vacation time. And that, I mean, that's a starting point. So I would say, like, from an investment, like, just invest in vacations and enjoy yourself, and then come back and you're renewed again and you're not stressed out. You've got to, like,
Yeah, a little R&R, work play balance, right?
yeah.
Sweet. Well, hey, Joanne, thanks so much for hopping on today. I really appreciate all your insight. Do you want to tell people how they can find you to get more information?
Yeah, absolutely. You know what? Just email me. That's probably the easiest. I have a website, but it's like a complicated name. So it's just dentalcoach@newbornevolution.com. Dentalcoach@newbornevolution.com. Just send me a note and yeah, let's connect. I love to talk about this. You can see I'm very passionate about it. So thank you so much.
Yeah, thanks for sharing your passion, Joanne.